want to talk first about patient care. How do results of this test impact patient care? So when you're trying to connect the dots, the guiding principle of this site is that everything we talk about has to be connected to patient care. So how do these results impact the patient? What kind of decisions is the doctor going to make? What are the consequences of bad results? How good is good enough for your patients? How many bad patient results are too many? That's sort of a tricky question. We say, well, we don't want to report any bad patient results, but that's impossible, and pretty much all of QC accepts that. Is the method good enough now, and would your QC practices prevent bad results? So to guarantee patient care, you need to answer all of those questions. When you think about it from the doctor's perspective, he says, I'm ordering this test to decide if the patient has this, that, or the other, if the patient is getting better, getting worse, if they're responding to therapy, if they're not. Whatever question he's asking, he or she, there is a decision-making process going on in the back of their mind. If the result is below X, I'm going to think A and do this. If the result is between X and Y, I'm going to think B and do nothing. And if the result is above Y, I'm going to think C and do that. So your results lead to decisions, which lead to actions, that lead to outcomes, that leads to cost. So if the patient is really normal and you report them as abnormal, bad things will happen. If the patient is abnormally high and you report them as normal, bad things will happen. If you're screening and the patient is really positive, but you tell the doctor they're negative, this person can go on for a long time before they're treated. And if a patient is responding to therapy, but you say they're not, then the doctor's going to make the wrong decision, perhaps put them on more aggressive therapies